Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you are just joining us, we are talking about psoriasis. It's a condition that can be embarrassing and difficult to get rid of. Those with psoriasis often have raised, thick red patches on their body that are dry and covered with silver, flaky skin. We have quite a few questions from our viewers, Doc, so let's get straight to those.
Sure.
John from Harmon asks, I have many of the symptoms of psoriasis. Is there a special test that my doctor can do to confirm if I have it or not?
Yes, the best test would be to do a biopsy where a small cookie cutter type device is used to take a small 4mm punch of your skin and then send it to Hawaii and take a look at it under the microscope. But honestly, most of the time that's not necessary because just by the appearance of the lesions we can tell what the disease is.
Okay. Sean from Jigo asks, how do I know if I really have bad dandruff or if I have psoriasis on my head?
So Sean, usually dandruff is not itchy. With psoriasis, the plaques that people get on their scalp are stuck onto their scalp. There are flakes that come off, but there is an itchy patch stuck right onto the head. Very, very itchy. It tends to be behind the ears and the back of the head, but it can cover the whole scalp. So if there's just flakes, it's not much to worry about.
Okay. Janelle from Assen asks, are there any specific lotions that can help reduce the scales and the redness?
Yes, there are. There are prescription medications that are generally topical steroid medicines as well as non-steroidal ones. There's a whole range. We have about 20 different tools that we can use that patients can try. And it's often a question of trial and error before we find one that works well for them. Over the counter, you should focus on moisturizing. Choose thick, sticky lotions or oils and use them frequently because that will help you more than anything.
Okay, Mary from Tumon asks, I have arthritis and I think I have psoriasis. Is it linked?
It is. About 10% of people with psoriasis will also have psoriatic arthritis, which most of the time affects fingers and toes, but it can affect other joints as well. And people will get swollen, very, very painful joints. They can take medication for that also.
Okay.
Yeah.
Martin from Telefofo asks, are there certain foods that might contribute to flare-ups?
Not really. Psoriasis is an immune system condition. It really doesn't have a whole lot to do with your diet, although you should always eat a healthy diet.
Okay, Nicole from Agate writes, it's embarrassing to wear certain clothing with my red dry patches showing. Is there anything I can do to cover them or make them less noticeable?
This is really a very difficult problem. As we were mentioning, when people have psoriasis, they feel ashamed, they stay covered up, they even stay indoors, they won't go to certain events because they're so embarrassed about their skin. So to cover it is very difficult. It's very thick and there isn't any makeup or kind of thing that would cover it. In fact, covering it doesn't allow sun to hit it, and oftentimes a little bit of sunlight will really help your psoriasis. So I think the best thing to do is to get in and get some help with prescription medicine.
Okay, and Fran from Barragota asks, my husband and I have psoriasis. Is it likely our children will have it too?
It really is, unfortunately. In the general population, about 3% of the population has psoriasis. If you have one parent, you have about 25% chance, and two parents, you have a 50% chance of having psoriasis. So I think if you see some lesions on your child, please bring them in.
Okay, is there anything else that you'd like to leave with our viewers as we talk about this topic?
There are some great resources on the internet. It's the Psoriasis Foundation. You can go to www.psoriasisfoundation.org and you'll get some very good up-to-date information. Since it is a chronic disease, people search on the internet and they spend a lot of money on useless miracle cures, and I always advise against that. So I'd like you to go to a reputable website and follow their advice.
Okay, Doc, thank you as always. And I was going to mention another website that is, for those who want more information, they could go to psoriasisspeaks.com, and I think that's linked to your organization as well. Dr. Lom will be back again next Tuesday when we are talking about the battle of the bulge. You don't want to miss it as we talk about dieting and getting into shape for the summer. Send us your questions to healthyliving@kwam.com, or of course post your question on our Facebook page. There is